An aortic aneurysm is an abnormal dilatation of this large artery coming out of the heart, of the left ventricle. It's a very severe condition because it can have complications like rupture or dissection, with mortality as high as 80%. The second problem is that it is largely underestimated, and the diagnosis mainly remains based on imaging. Now, the problem of patients with an aortic aneurysm is that they have a lifelong struggle with the question that is, what is my personal risk of having a life-threatening complication? You have to bear in mind that more than half of patients with an aortic complication actually have the size of the aorta that is below the thresholds that physicians and surgeons use to decide for a prophylactic surgery. So to tackle this complex issue, we all came together from different backgrounds, physicians, surgeons, researchers, engineers, into a European project that is funded by the European Union, an EIT Health project called CMR-AI. We have 9 partners, and this is led by Sorbonne Université in Paris. In this project, what we want to provide to patients is a platform so that physicians all across Europe are able to provide a score predicting the aortic risk of patients to have a complication. This eventually will be able to help physicians and surgeons and patients taking this difficult decision of having surgery in order to prevent the severe complication of an aortic aneurysm. Currently, CT is the imaging modality that is mostly used in patients with aortic aneurysm. The first task in this project will be to demonstrate that MRI can replace CT, being a non-invasive imaging exam that gives both the anatomy of the aorta, but also the blood flow and the elasticity of the aortic wall. The second step will be to put together a software that will allow physicians to measure precisely for each individual patient the size of the aorta, the shape of the aorta, but also the blood flow and the forces on the wall that may promote the complications of the aorta. In the end, what we want to achieve is to have a score for each individual patient of his individual risk to have an aortic complication, and to be able to help in the decision-making process of having surgery before these tragic events occur. So in the end of this project, there will be 3 main game changers. The first will be an access for the patient to a very fast MRI, which is non-invasive without contrast injection. The second will be the ability for the physicians, the radiologists, cardiologists, and surgeons to have access to this new information to help in the decision-making process with both the anatomy and also the flow and the dynamics of the aorta. Third, we will be able to demonstrate the feasibility of this new patient pathway across Europe, and also to study the medico-economics across countries in the north and the south of Europe for all European patients.